Ever pondered about what a urinalysis test is and why doctors insist on it? Well, let's delve into this topic. A urinalysis test is a series of examinations performed on a urine sample. It's a common, non-invasive procedure that provides valuable insights into a person's health. It's routinely used in wellness screenings, helping to detect potential health issues before they escalate. Before surgery, a urinalysis test assists doctors in evaluating your readiness for the procedure. For expectant mothers, it's crucial to monitor the health of both mother and baby during pregnancy. And for those managing kidney disease, it's an indispensable tool in monitoring the condition. Furthermore, it's used to identify symptoms of urinary tract infections, manage diabetes, and even diagnose conditions that cause hormonal imbalances. So a urinalysis test might be more significant than you think. It's not just about peeing in a cup. It's about taking a proactive step towards better health. Now, you might be asking, what exactly does this urinalysis test check for? Let's get into that. This test is a comprehensive examination of the urine, which gives us an inside look into how well your kidneys are doing their job. Your kidneys are like your body's very own filtration system. They tirelessly work to sift through your blood, getting rid of waste while preserving the important parts like proteins and minerals, also known as electrolytes. This intricate process results in the production of urine. So, a urinalysis test looks at the contents of your urine to get a snapshot of what's happening inside your body. It examines multiple elements, each telling a unique story about your health. Firstly, it checks for proteins. Now, proteins are essential for our body, but they should remain in the blood. Their presence in urine could indicate some issues with kidney function. Next, the test looks for sugar or glucose. Typically, your kidneys reabsorb glucose and return it to your bloodstream. If glucose is found in your urine, it could be a sign of diabetes, a condition where your body struggles to control blood sugar levels. The test also examines the presence of blood cells in your urine. Red or white blood cells could indicate different health issues, ranging from kidney disease to urinary tract infections. Lastly, the test looks for bacteria. Our urinary system is typically sterile, so the presence of bacteria could suggest an infection, but it's not always as straightforward as it seems. Sometimes having too much protein, glucose, blood cells, or bacteria in your urine could be due to other factors like medication, diet, or even dehydration. That's why, if your urinalysis shows any of these, you may need additional testing to pinpoint the exact cause. In essence, a urinalysis test is a deep dive into your body's waste disposal system. It's like a detective, finding clues in what we usually dismiss as waste and giving us invaluable insights into our health. So the next time you're asked to take a urinalysis, remember, it's more than just a simple urine test. Let's talk about the sample collection process. How do you do it correctly at home? It's important to get this part right because the quality of your sample can impact the accuracy of your test results. First things first, your healthcare provider or lab will provide you with a clean, sterile container for the collection process. This container is specifically designed to ensure that no unwanted substances contaminate your urine sample. Now, when should you collect your sample? Usually, it's best to do this first thing in the morning. Why? Well, urine is generally most concentrated at this time, providing a more accurate reflection of what's happening in your body. The process itself is straightforward. You'll want to start urinating in the toilet first, then midstream, you'll collect the urine in the sterile container. This method, known as midstream collection, helps to avoid any bacteria that may be present at the beginning or end of urination from contaminating the sample. One crucial thing to remember is to avoid letting any toilet paper or fecal matter get into the container. These could introduce bacteria or other substances that could skew your test results. Once you've collected the sample, securely screw the lid onto the container. It's important to make sure the lid is tight to prevent any leaks or spills. Next, you'll want to refrigerate your sample until you can get it to the lab. This helps to preserve the sample's integrity by slowing down the growth of bacteria that may alter the test results. Finally, return the sample to the lab as soon as possible, following the instructions given to you by your healthcare provider or the lab. And that's it. You've successfully collected your urine sample at home. It's a simple process, but one that requires careful attention to detail to avoid contamination and ensure the most accurate results. Remember, the accuracy of your test results depends on how well you've collected your sample. So take your time, follow the instructions closely, and if you have any doubts or questions, don't hesitate to reach out to your healthcare provider. What happens once you've collected your sample and sent it to the lab, you might ask? Well, let's dive into the fascinating journey your urine sample undertakes in the lab. The testing process unfolds in 3 crucial stages, each designed to extract specific information about your health. The first stage is the visual examination. This is where the lab technicians take a good look at your urine sample. They are checking for things like color and cloudiness. The color of your urine can reveal a lot about your health. For instance, clear, straw-colored urine typically indicates good hydration, while darker hues might suggest dehydration. Cloudiness, on the other hand, could hint at an infection. Next up, we have the dipstick tests. Now, this isn't your average dip and stir kind of test. The dipstick is a special plastic strip imbued with chemicals that react to substances in your urine. When the dipstick is immersed in your urine sample, these chemical patches change color if they detect things like proteins, glucose, ketones, and certain byproducts of red and white blood cells. This step helps in identifying conditions like diabetes, kidney disease, and urinary tract infections. Finally, we reach the third stage, the microscopic examination. If you thought the dipstick test was thorough, wait till you hear about this. During the microscopic examination, a small amount of your urine is placed under a microscope. This allows the lab technicians to spot things that the naked eye can't, like bacteria, blood cells, or crystals. Finding these elements in your urine can provide valuable clues about various health conditions like kidney stones or infections. So there you have it. From the moment your sample arrives at the lab to the point when the results are ready, it undergoes a meticulous testing process. This isn't just about peering into a cup of urine, it's about decoding the secrets that your body is trying to tell you. The testing process is thorough, ensuring that nothing escapes the watchful eyes of the lab technicians. Once the test is done, how are the results reported and what do they mean? Let's dive into the interpretation of urinalysis results. The results are usually reported in a few different ways. Some are reported as values. Your doctor will compare your results with the normal ranges. Keep in mind, these reference ranges may vary among labs and hospitals. Other results may be based on the color and odor of your urine, and still others may be reported as simply positive or negative. If your urine appears cloudy, it could be a sign of a urinary tract infection or UTI. A distinct acetone odor may point to a buildup of acids in people who have diabetes. A fecal odor could suggest an abnormal connection between your intestines and your bladder, known as a fistula. If the urine has an ammonia odor, it may mean the urine has stayed in the bladder for too long. A pungent odor could also be an indicator of a UTI. Now, if there's blood in your urine, it might be a sign of kidney disease, a UTI, or other conditions. The presence of white blood cells could indicate a UTI. Crystals in your urine could be a sign of kidney stones or other kidney diseases. If your urine has a high pH, it may mean you have a kidney stone, a UTI, or kidney disease. The presence of protein in your urine might be a sign of kidney disease, high blood pressure in pregnancy, or other conditions. Glucose in your urine could be a sign of diabetes. Urobilinogen, a byproduct of bilirubin metabolism, might indicate liver disease. Leukocyte esterase, a product of white blood cells, might be a sign of a UTI. Lastly, nitrites in your urine could also indicate a UTI. Remember, many conditions can cause an abnormal urinalysis. These are just some of the possible implications of your results. Interpreting your results can be complex, so it's crucial to discuss them with your healthcare provider. They will provide the most accurate interpretation based on your health history and current symptoms. Before we wrap up, let's talk about the questions you should ask your healthcare provider regarding your urinalysis test. It's essential to stay proactive in your healthcare journey, and asking the right questions can make all the difference. First, inquire about the timeline of your results. Ask, when should I expect my urinalysis results? This will give you an idea of when to follow up. Next, discuss about the potential outcomes. You might ask, what could the possible results indicate? And what are my treatment options if the results are abnormal? Finally, understand the path forward. Ask, what other tests might I need based on these results? And what are my next steps? Remember, your health is a precious asset. So stay informed, ask questions, and always consult with your healthcare provider. Thank you for watching. If you found this video interesting and informative, why not share it with a friend or a family member? Also, will you like, share, and subscribe to the channel? In doing so, it will increase the chance of the valuable information in this and other videos crossing the paths of others. Like yourself, allowing them to benefit like you did. Again, thank you and be blessed.